Welcome to Sleepy Nursing, the podcast where we break down nursing school stress into something you can actually fall asleep to. I'm Nick, for some of you, Mr. Forney, and I teach nursing students how to think critically, survive the chaos of nursing school, and still get some rest. Whether you're cramming for exams or just need a calm voice with a stethoscope, you're in the right place. For our introductory episode, I'd like to discuss an article that was recently published in the National League for Nursing's journal titled Empowering Faculty to Incorporate Large Language Models in Nursing Education Using a Delegation Framework. I'll provide a citation in a link below. So what are we talking about? Large language models. This is ChatGPT. There are some other models out there too, things like Claude, and there's a bunch of them at this point. You can even put them on your own computer at home to some extent. If you're in nursing school now, you've most likely experienced this. They can be powerful tools to help our studying and to help our comprehension and brainstorming too. But we have to be able to make sure that we're using these tools responsibly and ethically, and they're furthering our learning and not acting as a crutch or a shortcut or something. Just like delegation in nursing, delegating using AI should involve responsibility, supervision, and critical judgment. Everything in nursing. This article did a really good job breaking down some of our considerations we need to make when we're talking about delegating tasks to artificial intelligence. You'll find these tasks familiar, particularly to delegating tasks to other assistive personnel in the hospital space. And they also sound a lot like some of our rights of medication administration too. So I appreciated this approach, because it brings us back to something we're already familiar with. So we're going to go over 5 rights of delegation for AI. Our 5 rights, again, familiar rights, should include right task, right circumstance, right person, right supervision, and right direction and communication. So when we're talking about the right task, we want to make sure we're using AI for a task that's appropriate. In the setting of nursing school, this should be using artificial intelligence to support learning, not to replace it. Think about an example would be something like having AI explain something to you. This is a great example. Maybe you're having a hard time understanding a pathology or a body process that you went over in class. Maybe you just didn't connect with the way that instructor brought it to you. I do my very best to present information in a way that all my students understand it. But if I have 17 students in a class, I have 17 different ways that people need to learn something, and maybe I won't be able to reach them all. You can support your learning by using some of these resources. Further, if you find you're struggling to take your next steps, you have some ideas of what you want to do, but you're not sure how to execute them, AI is great for brainstorming. If you're working on a care plan, you can provide some, remove any of the patient-sensitive information from it, but provide some background, like a handoff report to the AI about your patient, and then ask your patient or your AI, can you list 5 possible nursing diagnoses for this patient? Then it's up to you at that point to choose from the nursing diagnoses that the AI provides you what actually fits your patient, which is the important part of the whole exercise, at least in my mind. Remember, the AI outputs, the data you get from them, are only as good as the data that the AI is trained on. For ChatGPT, for example, my understanding is their information stopped around 2021, so it's not necessarily the most current. Different models will have different timelines of data and pools of data that they're pulling information from. And in addition to that, AI's goal, ChatGPT's goal at least, is to provide you the answer you want to hear. And it's not based in fact necessarily. It often does provide good information, but you need to verify it. Think about how we've been taught to use Wikipedia. We don't want to use it as a primary source, but it can be a great source to get background and get an idea before we dive a little deeper. So next, right circumstance. Is it appropriate to delegate this task to something else? When we think about delegating in the hospital, this is something like vital signs. For most patients, we can delegate vital signs to the unlicensed personnel. But for example, if we've just hung a unit of blood, we really need to be the ones to take those first couple sets of vital signs around that so that we can assess if there's any acute changes or something wrong. The same idea is true with AI. Is this an appropriate thing for us to delegate to the artificial intelligence? Should we be making this information entirely ourselves? Or is it appropriate to get some extra help? What are you looking for? If you're doing for an assignment, what's your instructor looking for? It is a great idea to use AI if the goal is exploration, background information, even clarification to an extent, but it's not appropriate to use AI when we need to demonstrate that we have the judgment to make a decision. It can be very good for translating medical jargon in much the same way that we talked about under right task, the right circumstance. If we have medical jargon that we kind of conceptually understand, but we're struggling how to get it across to a patient or a family member, AI can be really good for bringing that into focus. It can also be really good for changing the tone of a document. Think if you've ever been emotionally charged when you're reaching out to your boss or a coworker or even a friend or loved one, this can be a tone check that you submit your document to. You've created the original thoughts and the points that you're making, but now you have something that can act without judgment and tone that more professionally, so you're getting across what you want to get across without saying something you might regret. That's a good circumstance for it. Whereas if you're supposed to demonstrate that you independently can discuss a topic or determine a judgment, or if your instructor provides you 4 patients with different health considerations and you're tasked with prioritizing which ones you're going to assess first or something, that's not the right time to use ChatGPT or AI. Our third right, the right person. We need to remember AI is not a licensed medical professional. If you're in school, you're training to become a licensed medical professional. Once you're a nurse, you are the licensed medical professional. AI is not. It's not there to judge the accuracy or the context. That's where nurses shine. Finding the context and finding what fits for our patients. So when you approach these kind of tasks, I want you to always ask, is AI the right tool for this? Just like you'd ask, is this the right person to delegate something to? Sometimes you may be better served by looking up a fact in a drug book or a textbook, or looking up something in a policy guide. For example, if I want to look up metformin, my first stop should not be to ask ChatGPT what metformin is. My first stop should be to look in my Davis drug guide, for example, or Micromedics, depending on what the hospital system is using. Now, once I have some of that information, I may be well served to use ChatGPT to turn that information into a form that I can understand better or my patient can understand better. But my initial source for that kind of information should be something that's been verified, peer-reviewed, a real definitive source. Our next right is right supervision. Just like with our nurse aides in the hospital, it's not good enough just to tell them to go collect the vital signs. I need to follow up and make sure the vital signs make sense, that they were completed. A bed bath, for example. Did they do the bed bath? I still need to go in and do a skin assessment too. So with AI, how am I going to tell that the information I've received is correct? We want to validate the information the AI provides against primary sources. Think literature, clinical guidelines. This is where your textbook can come in to validate what you've gotten from AI. And remember, if you're submitting something to school, you're responsible for the information that you use. If you are providing teaching to patients, it's even more important. You're responsible for the validity and accuracy of that information. Something to keep in the back of your mind is AI can invent sources. It's not totally reliable on that sort of thing. You need to make sure the information you get is right. For example, AI cannot necessarily get through every paywall on the internet. It can see a title and maybe even an abstract of an article, and it can take that and run wild with it and produce answers that have nothing to do with what the actual article had. So we have to make sure we're getting the information we want out of this. Our final right is right direction and communication. So this is what we're telling to AI. If we put poor prompts into it, we're going to get poor prompts or poor responses out of it. Garbage in, garbage out, so to speak. This is a place where if we give more detail for exactly what we want, we can get a better answer too. If you're in school, this might be a good opportunity to collaborate with your faculty and be transparent with how you're using AI in your assignments. I know for me, for example, I'm very open and excited for students to figure out how to integrate AI so you can find its strengths and its shortcomings as well and integrate them into your practice. I know it's a rapidly changing area of nursing, so some places may be less enthusiastic about that, but we need to try to stay ahead of the curve so that we can maintain our professional practice, or else we risk being left behind. As you work through this, document how you're using AI. Pay attention to any limitations you face, and make sure you're citing responsibly, as we always do. Why is this all important? The health industry is already adopting AI. The academic industry is definitely using AI. I'll tell you for a fact. One of the schools I work for is even paid for full-time faculty to have a ChatGPT account, a Plus account or something to that effect. This is here now. It's not going away anytime soon. So we need to learn how to leverage it in our practice. That way we can grow and our practice can be stronger because of it, rather than being left behind or missing out on opportunities, leaving something on the table. We can use these large language models responsibly to help develop our critical thinking, expanding our mind, and not use it as shortcuts. This can be something that makes your work better if you use it correctly. And ethical use of AI now will prepare you for future roles where digital tools will be more routine in clinical settings. They are already in some of the settings I've been in. I know bed management at our big hospital is starting to use artificial intelligence to help navigate where patients are going to end up. There are some places, I haven't personally experienced this, but they're using AI to some extent to make some clinical decision making. So it's here and we need to learn it. To conclude this, I do want to push y'all, if you haven't tried ChatGPT or any of those, try it. I know ChatGPT has a free tier. If you really get into it, it will get a little limiting because it'll only let you send so many prompts in a day, and then it'll reset you. But you can get a feel for what you can actually get out of it. A lot of our email clients have AI built into them to do that, reframing your email, changing the tone so you come across the way you want or make your email more professional. Give it a shot. It doesn't cost you anything. Just remember, using this in practice, just like using delegation in practice, requires judgment, accountability, and supervision. We want to use this ethically, safely, and wisely so our practices are better and we can bring better care to our patients and learn in a more effective way. If you all have enjoyed this and would be interested, I could certainly make a example video of how I've integrated ChatGPT into some of these prompts, the changing the tone of an email to the explaining things to even making practice NCLEX questions with ChatGPT that can be so focused. So please give me feedback. If you're in my class, let me know. You can send me an email. If you're seeing this on YouTube or on a podcast service, leave a comment or something. I'd be very open to doing that. Anyways, again, this is Nick with Sleepy Nursing, and I hope you have a good one.